Hey everybody, and welcome back to another video on Alzheimer's research, how to reverse Alzheimer's disease, how to improve cognitive function for you or a loved one, whoever that may be, whether it's mild impairments or it's getting to be severe impairments. We want to talk about how we can actually improve these things and turn back the progression of Alzheimer's disease. And so this is the third video in my series. And in this video, I've talked about things that you can do, modifiable risk factors, things that you can have an impact on that can improve brain function and can reverse some of these issues that you're having with Alzheimer's, you or a loved one. And so in 2020, there was a publication put out in the Lancet that included 12 modifiable risk factors. Now, if you're following along in the book, which is Reversing Alzheimer's by Dr. Heather Sandison, this is on page 37, so you can refer to it there. So they list 12 modifiable risk factors, and again, these are things that you can have an impact on for the most part. And there's a couple others that I'm going to throw in towards the end, but I just want to go through them so that if you're trying to figure this out, you can start thinking, what are these ones that you can improve? Now, before I overwhelm you with a list of 12 things that I'm probably going to bump up to 14 by the end of the video, what I will say is this. As I'm going through the list, think of it from one of two perspectives. The first perspective is there something on this list that would be easy for you to do? Easy for yourself or your loved one, if you're a caregiver, easy for you to implement that might have a positive impact. So you could just start small and say, what's the easiest thing that Luke just said, or one or two things that I think is going to have a positive impact, maybe not a huge positive impact, but something that I can just get the momentum going. I can just get my feet wet and just feel like I did something. That's one way to look at it. Low-hanging fruit, we'd call that, right? The second thing you could look at, second perspective you could say is like, if you really want to have a huge impact on either your cognitive function or your loved one's cognitive function, you could say, what's the one or two things that, yes, they're difficult, but I think they're going to have the biggest bang for my buck, the biggest return. So you can think of it either way. So just think about that. So I'm not trying to overwhelm you, but there's lots you can do, but sometimes that just does feel overwhelming. So let's dive into it. So this again is from the Lancet in 2020. The first one is, and this is somewhat modifiable, they say you have increased risk of Alzheimer's disease if you have less education. And I think part of that is just staying cognitively active. So I'd say if you're an older adult, you say, gosh, I only made it through high school, I didn't make it through college, you're more likely to have dementia and Alzheimer's. Like, well, technically, yes, but part of that is just because you may not have as much brain activity then, so maybe not as much now. So it's still modifiable because you can always increase your education, even if it's not a standardized, degree or certification or something like that. So the more you do for education, the more you continue to learn. That's a modifiable risk factor. Okay. The second one is hearing loss. Hearing loss is really predictive of a lot of brain disease, including like Parkinson's. So if you do have hearing loss, I would highly recommend you get some hearing aids, or figure it out with an audiologist or whoever does hearing aids. Figure out how you can hear better, because when you don't hear that well, you just don't get as much activity to your brain, and you tend to be less engaged in conversations and social things like that. So hearing loss is the second one. Traumatic brain injuries. That is one, obviously, if you've already had a traumatic brain injury, we call it TBI. Nothing you can probably do now except work on, healing it and recovering from it. But if you're still active and you are, biking, skiing, what else? Riding a motorcycle, try to wear a helmet. So try to reduce your chances of a TBI. Hypertension, this one is very modifiable. So this hypertension is a fancy word for high blood pressure. So if you have high blood pressure, that is indicative of a higher risk for dementia and cognitive decline. So get that fixed. The next one is weight. And obviously, if you're watching this in the United States or wherever you are, weight is a huge, huge problem in our country. And it's basically going to increase your risk of every possible disease you can imagine, including diabetes and cancer and heart disease and all these things. And it's increasing your chances of Alzheimer's disease as well. So that's another modifiable risk factor. And this is something I highlighted on page 38. It says that even losing a small amount of weight, so 4.4 pounds, at midlife in people with a body mass index of 25 or higher is linked to a significant improvement in attention and memory. Isn't that fascinating? So just losing 4.4 pounds, they've found, can have a positive impact, a significant improvement on attention and memory. So even if you say, gosh, I have 50 pounds to lose, even losing that first 5 has been shown to have a positive impact on your brain. Great, so the next one is excessive alcohol consumption. And this is probably kind of a no-brainer for a lot of people, but just in general, alcohol is bad for your brain. So, you can try to sugarcoat it if you want, but at the end of the day, it's bad for your brain. And it is, in basic terms, it's a neurotoxin. Plus, alcohol tends to have a negative impact on your blood sugar, which is a super big problem with Alzheimer's disease, blood sugar in general. Okay, next risk factor, modifiable risk factor, is physical inactivity. I mentioned this before. I'll mention it again in future videos. Exercise is a massive, massive thing you can do to improve cognitive function, and not exercising obviously is a risk factor for that. Okay, next up is depression. Depression, again, is going to increase your chances of Alzheimer's disease and cognitive decline. So that goes hand in hand with lots of things. Do you get out and socialize? Do you exercise? Do you get exposure to fresh air? So whatever you can do to improve depression is going to have a positive impact on your brain. After that, our next risk factor is type 2 diabetes. I've mentioned it a little bit. High levels of blood sugar have a very negative impact on your brain. They talk about this at some point in the book, how it basically can kind of like caramelize your neurons in your brain, so slowing things down in your brain. They actually refer to dementia as type 3 diabetes, or Alzheimer's, as type 3 diabetes, because the link between diabetes and elevated blood sugar and elevated insulin is so strong with Alzheimer's disease, which is why you'll see later in the book we talk about like doing really low carb, low sugar diets and higher fat diets, which is good for your brain. So that's a huge risk factor that you can have an impact on. Next up is smoking. Smoking has a negative impact on your brain, just like it does on your heart and your lungs. So if you're a smoker, reduce your smoking and hopefully quit if you can. After smoking is air pollution, kind of similar to smoking, right? Polluting the air as you breathe it in. But air pollution is a big one. And I mentioned that in the video previously, how just getting fresh air, using air purifiers is a huge thing you can do to improve your cognitive function and reverse some negative effects as well. Social isolation is the next one. Getting out. There's a lot of studies that you just need to stay socially active regardless of your age, but especially as you age and get older. Social isolation is a huge risk factor for cognitive decline. Okay, and then the last one they mentioned here for modifiable risk factors for dementia is sleep disturbances. So lack of sleep, fragmented sleep, that's a huge risk factor. Because basically what happens with sleep, especially deep sleep and REM sleep, is that your brain has this thing called a glymphatic system, kind of like your lymphatic system in your body. It's called glymphatic. And your brain is basically cleaning itself and restoring itself at night when you sleep. And if you aren't getting the sleep you need, basically I think of it like as the garbage and the toxic goo is just building up in your brain over time. And that has a very strong correlation with developing dementia and Alzheimer's disease. So whatever you can do to improve your sleep, addressing sleep apnea, addressing insomnia, things like that, there's a lot you can do to improve your sleep. I might even link a video that I made a while back to that at the end of this. So yeah, improve your sleep if you can. So those were the 12 modifiable risk factors. Hope you got some goodness out of that. There's 2 more that I really need to share with you though, so don't go quite yet. If you've hung with me this long, keep going. One of the risk factors that wasn't on this report is really fascinating, and it says if you are a caregiver, like a primary caregiver for a loved one or a spouse with Alzheimer's disease, you are 250 to 600% more likely to get Alzheimer's yourself than the general public is. And that's kind of scary. So you're caring for someone who has like Alzheimer's, dementia. For whatever reason, you are 2.5 to 6 times more likely to have the same problem yourself. And it goes into this later in the book. There's a whole chapter on caregivers, which is really helpful if you are the caregiver, how to take better care of yourself. But you might be saying, well, why would that possibly be? And I think a couple things come to mind. The first one is that it can be very stressful. That's one risk factor, right, for brain health. Social isolation can happen if you are taking care of this person with cognitive decline, especially if it's severe, because you guys can't go out and do the things you used to do as much. You don't see your friends as often. So that's another one. And then when you look at a lot of these cognitive issues, you really need to take a look at your environment and specific toxins in your environment, such as mold. And so that's something they don't really talk about in the book, but that occurred to me, having had some experience with a family member with severe mold poisoning, is that if one of the reasons that you or your loved one have cognitive decline is because of these toxins in your environment, well, if you are the caregiver, you're being exposed to the same toxins more than likely, if they're ongoing toxins and not like childhood toxins. So anyhow, if you're a caregiver, it's a significant risk factor. Read the book, read the stuff on how to take care of yourself as a caregiver, because that's super important. And then the last one that I had written down, it's the same thing, toxic exposures. So that's number 14. Again, if you're having the same toxic exposures as the person with dementia and Alzheimer's, you could understand why it's going to increase your risk of it as well. So there's your modifiable risk factors. Again, I hope I didn't overwhelm you. I hope you found one or two things that you can dive into to improve your mental health or the mental health and cognitive function of a loved one. Please leave a comment before you go. Let me know if it works. Let me know if you've had positive results doing things like this, and hopefully your comments will help somebody else improve their life or their life of their loved ones, which will improve their life as well. So thank you for watching. Best of luck. Check out the book if you want more information, and I'll see you on the next video. Thanks.